Vitamin E is a powerful antioxidant, similar to vitamin C in its biologic importance. But unique to vitamin E is the fact that it is fat soluble. And this has significant physiologic implications, and it's one of the main reasons why vitamin E is so important for musculoskeletal health. In reality, vitamin E does not describe one particular molecule, but describes 8 naturally occurring substances that have very similar structures. So all 8 of these substances, when you ingest them, are absorbed in the small intestine. But interestingly, the liver selects out one vitamin E derivative in particular. It's called alpha tocopherol, and that is the vitamin E that is referenced and referred to in recommended dietary allowances and on supplement panels. It's this particular vitamin E derivative, alpha tocopherol, that is then exported to the rest of the body for usage. Free radicals are high-energy toxins that attack healthy structures, such as protein, DNA, RNA, and healthy fats. Now, your body has these natural defenses to help protect against free radicals. However, sometimes these natural defenses are overwhelmed. And then when that occurs, you get a situation that's referred to as oxidative stress. Now, fat is very sensitive to oxidative stress, both on a microscopic and macroscopic level. When we think of fat, we often think of the fat that's localized to our belly or to our buttocks, but there's areas of fat that are located next to joints, to bones, to tendons and muscles. And recent research suggests that these areas are crucial, integral in the overall development of injury and chronic conditions. A particular area in these fat regions and in cells in general is the cell wall that is very sensitive to free radical injury. And so the idea is that a free radical attacks one particular area of the cell wall, and this ignites a chain reaction that we refer to as lipid peroxidation. Now, this can be a devastating occurrence for the cell wall because what you essentially get is a massive puncture in the cell wall due to this lipid peroxidation that allows the contents of the cell to leak out, which oftentimes leads to cell death and commonly leads to cell dysfunction. And so vitamin E is a crucial component of the body's natural defenses against lipid peroxidation and free radical injury to fat because it's fat soluble. So vitamin E can easily diffuse through the fat into the area where this free radical attack is occurring and neutralize these radicals to protect the cell wall and to protect fat in general and help prevent some of the degeneration that occurs because of oxidative stress. Oxidative stress is a risk factor for unhealthy joints, and there's evidence to suggest that it helps drive the deterioration and degeneration of the joint. Researchers in Boston looked at a population of people who had unhealthy joints, and they observed that this population had a lower intake of vitamin E. They also observed that populations that had an increased consumption of vitamin E were less likely to have unhealthy joints. Excessive exposure to free radical toxins is a risk factor for unhealthy bones and increased risk of decreased bone density. Researchers in Sweden looked at the association between vitamin E and fracture risk in adult populations of both men and women. What they observed is that the groups that had an increased consumption of vitamin E had a decreased risk of fracture compared to groups that had a decreased consumption of vitamin E who had an increased risk for fracture. Oxidative stress has been identified as a risk factor for unhealthy muscles, specifically a condition called sarcopenia, where you have a dramatic loss of muscle mass and you experience weakness. Researchers in the United States evaluated the blood concentrations of vitamin E in the elderly, and what they identified is that vitamin E Lower concentrations of vitamin E are associated with dysfunction, disability, and deconditioning in this elderly population of individuals. Seeds and nuts are excellent sources of vitamin E. Dark green leafy vegetables are also a fantastic source. To get your recommended dietary allowance, you could take a cupful of sunflower seeds and a cup of spinach. You mix it together, you consume it, and you got it. You're over 100% for sure. In terms of consumption and preparation tips, vitamin E is sensitive to exposure to oxygen, so the longer you leave something out, the greater the risk of having the vitamin E degradation. And vitamin E is also sensitive to cooking with high temperatures, so cooking things at a higher temperature also will lead to greater degradation of vitamin E. Vitamin E is generally well tolerated from natural sources. If you're considering supplementation, please discuss with a qualified health practitioner who's familiar with your unique medical history prior to use.